Hey guys, Tony Maritato here, licensed physical therapist, and I want to answer Nancy's question. This was a question that warmed my heart because it's just so great to see people thinking about this. So in the total knee replacement support group for kind people on Facebook, Nancy asks, I'm 3 months post-op. With physical therapist help, I can bend my knee to 115 degrees of flexion. I'm bending it on my own to about 95 degrees of flexion. They're talking about an MUA, which for those of you who don't know, it's a manipulation under anesthesia. What are some things I would be missing out on if I stopped at 95 degrees? So Nancy, first, thank you so much for posting your question. I would say that really you don't ever stop, right? None of us ever stops. Our bodies are changing every single day, every single moment of every single day. Some days I can do more, some days I can do less. You're going to find that your body remains incredibly adaptive. While it might not adapt today as quickly as it did adapt when you were 20, it will still adapt. So if there are things that you want to do that you feel like you can't do because your knee won't let you do them now, if you continue to practice those things, your knee will continue to change and adapt along with your hip and your ankle and other joints that are going to compensate for the physical activity that you want to do. So some patients feel that they can't comfortably walk down the stairs. Walking up the stairs is pretty comfortable for most people, but walking down the stairs, especially foot over foot, the way you normally would walk down the stairs, that sometimes is difficult if you don't have 100 degrees of flexion or more. But what I would tell you if that is something that is important to you, the more you practice, the more you work on it for the next month, the next year, the next decade, it will absolutely improve. And if you decide that you're comfortable where you are, that is the greatest gift in the world. Because the reality is, the only goal that is important is the one that's important to you. What your therapist does, what your surgeon does, what other people do, none of that stuff matters. So I would say the fact that you're asking what you might be missing out on is awesome because you're looking at the future. But the reality is, that's suggestive to me that you're pretty much doing everything that you want to do right now. And based on some of your other comments, it sounds like your knee is much better now than it was before surgery, which is a huge bonus. So I would tell you, don't worry about just because the knee isn't progressing on the time frame that's established by someone else doesn't mean you're never going to get to your goals. And so if you came to the therapist and you said, I want to do this, that, and the other, then you work on that. You know, if one of your goals is to be able to lunge and get something out of a low cabinet, you work on that, you practice that, you find alternative strategies and compensations to achieve that. But the fact that there's an arbitrary number on a piece of plastic that is read different between different therapists really means nothing to the fact that your goal is the only thing that matters here. So Nancy, keep doing what you're doing. I think you're doing amazing based on what I've seen in the Facebook group. And anyone else who might have questions for me or for any of the people who have had a knee replacement, feel free to join Total Knee Replacement Support Group for Kind People. It's on Facebook. It's free. It's a private group. I will be happy to do my best to answer your questions, but there is a huge group of individuals who have lived the experience that you're living, and they're more than generous with their time and their answers. I'll catch you guys on the next video.